Hello everyone, Dr. Aditya here. Welcome to the channel of the Shoulder and Knee Clinic, where we discuss regarding various sports injuries, shoulder issues, knee problems. So, an important topic today is what you can do after the shoulder replacement and what you can't do. So, we need to understand that basically there are two varieties of shoulder replacement. One is an anatomical shoulder arthroplasty, and then the other one is a reverse geometry shoulder arthroplasty. Both are different things which are done for different problems, and there are certain activities which you can do after each surgery with something which you can't do. So, starting with a anatomical or a normal shoulder replacement. So, yes, in both the shoulder replacements, around anywhere between 3 to 6 weeks, the hand is going to be in a belt. Overhead activities are restricted. Typically, in case of an anatomical shoulder replacement, after 6 weeks, you can start lifting your hand up, and it can take around 3 to 4 months to get the full mobility in your shoulder. Now, after that, generally lifting weights more than 5 kilos should be avoided from the shoulder. So, as such, in the short term, nothing will happen. But if you overload your shoulder consistently over a period of time, then you need to understand that it's an artificial joint. So the wear and tear will develop. So your shoulder replacement, which might be lasting for a very long period of time, might not last that period of time. So overloading needs to be avoided. Other than that, lifting your hand, taking behind your back, all activities, there is no issue. In the first 3 months after the surgery, generally sleeping on the operated side will not be possible. I mean, it's not very comfortable. But after that, once you're comfortable, you can start sleeping on that side. So, other important thing is whenever you have undergone these kind of surgeries, it's important that you don't participate in contact sports like kabaddi and MMA and all those things, because there is a risk of fracture around the shoulder replacement. So these activities need to be avoided. Now coming to a reverse geometry shoulder arthroplasty. So we generally start with earlier movement with a reverse shoulder arthroplasty, and by around 2 to 3 months, people tend to gain the movement in the shoulder. With a reverse shoulder arthroplasty, we don't expect people to gain the full movement, because at the end of the day, it is a surgery which is done for a problem which is very, very bad. So it is not possible to restore what is normal with a reverse shoulder arthroplasty. We try to give pain relief, decent function and movement. So you can lift your shoulder as you tolerate it, you can take it behind your back. Most important thing which you need to understand with the reverse shoulder arthroplasty is when you're getting up, don't use your hands like this to support your torso while getting up, especially in the first 6 months. So that is one precaution which you need to take, and you need to avoid lifting weights which are more than 2 kilos. If you lift weight more than 2 kilos, one, obviously the wear and tear will be faster. Second thing is, your reverse shoulder replacement essentially works with the functioning of a good deltoid. So if you overload it, there is a risk of fatigue of the deltoid, as well as there is a risk of fractures of the upper limb. So these are the two important restrictions which you generally have with the reverse shoulder arthroplasty. So if you like our content, do share, like and subscribe to our channel. We will keep on coming up with new similar videos. Thank you.